Good day, everyone. Allow me to present my research entitled A Close Encounter with Teacher AIDA, Phenomenology of Teachers Living with HIV. I am Jeffrey Alcantara Lucero, a professor from Western Colleges Incorporated and a nurse from the Department of Health.
Human immunodeficiency virus, or HIV, a virus that causes the deadly disease AIDS, has been first detected in the Philippines in 1984. Since then, the number of HIV cases among Filipinos continuously increases. At present, the total number of reported HIV cases in the country is more than 80,000, and the virus incessantly infects others, especially those in the reproductive age. People infected with HIV or diagnosed with AIDS are acceptably called as people living with HIV or PWH. We do not call them as HIV patients, HIV victims, and whatnot. In the Philippines, however, the feminine name AIDA is colloquially used to refer to them. Statistically, the IDAs in the Philippines generally rise from ages 25 to 34 years old. Such findings alarming since this age group generally refers to the productive age group of the country, being the young professionals who contribute to the nation's economy. An unhealthy population in this cohort would potentially retard the economic growth of the country. Moreover, it was reported that overseas Filipino workers account for 30 to 35% of all cases in the country. In the province of Cavite, data show that call center agents comprise the most number of HIV cases. It is also noteworthy that even professionals in the healthcare field also acquire HIV infection due to varying reasons. Aside from health professionals, there are also teachers who were not exempted from being infected with HIV. There are a number of teachers actively practicing their profession who are included in the HIV and AIDS registry of the Philippines. With those facts revealed, this research attempted to explore the lived experience of teachers living with HIV, whom we referred to in this study as Teacher AIDA. The challenges that they encountered amid being infected with HIV were explored, as well as how they perceive the future when living with the virus in their system. In order to acquire accurate and valid set of findings, data were gathered through triangulation using the following methods: observation, interview, and journal review. Four key informants participated in the study, and they were selected via network sampling through these inclusion criteria. First, they should be teachers in active service to the academe. And second, they should have a certification that they are diagnosed to be positive with HIV in not less than 2 years. These are the four key informants who gave their consent to participate in the study. Please be informed that the names used for each key informant are just pseudonyms solely utilized for reference purpose only. All of the key informants teach in the province of Cavite. Sirs Jam and Jel work as high school teachers, while Ma'am Shine is an elementary school teacher. Sir Den, on the other hand, works as a faculty member in a higher education institution, and according to them, they acquired HIV through sexual intercourse with their partner. On the subject of exploring the challenges brought by HIV into the key informants' lives, they have expressed similar set of experiences in their respective workplaces. Upon careful analysis of their responses, the themes that emerge to describe the impact of HIV into their lives can be summarized with the mnemonics 3S, which corresponds to the following: stigma and discrimination, somatic debilitation, and stress and depression. Being infected with HIV, the key informants have experienced stigma and discrimination. That is, feeling of being judged and rejected by the people around them. The key informants have also experienced somatic debilitation, which is being unwell and failing to perform some of their activities of daily living. Stress and depression has also been felt by the key informants upon learning that they are positive with HIV. They describe it as a feeling of sleepless night and too much sadness. Amid living with HIV and receiving treatments to suppress it, the key informants were asked how they perceive their lives in the future. Summarizing their diverse responses, it appeared that the key informants are concerned about their feelings on what their future would bring to them and their plans to live it. The key informants expressed several feelings on what their future would bring to them with HIV thriving within their system. According to them, looking at what would be ahead of them in the future with HIV is full of uncertainty and questions in mind. Nevertheless, the responses signified common themes which are generalized with the acronym AIDS, which means anxiety and worry to face tomorrow, intrepidity to surmount life challenges, dependence to treatment, others and God, and survival from a curse. When asked about their plans in the future in the midst of living with HIV, the key informants generally responded with a positive attitude. According to them, having acquired HIV crushed their being a person, thinking of the mean judgment that they might get from other people should they discover their condition. They also have this fear of becoming a burden to their family because of the debilitating effect of the deadly pathogen that invaded their system. Nevertheless, their unwavering hope that a cure will be discovered soon and the motivation given by their respective support groups keep their desire to live and continue fighting. According to them, they plan to do AIDS as they face what life brings to them as Teacher AIDA. AIDS in this context means advocacy for HIV and AIDS awareness, to remain in good shape, to get disclosed to the public, and engage in safe sex practices. This study was able to generate significant pieces of knowledge that allows its readers to understand more the life challenges faced by teachers living with HIV as they assume the role of being an educator and a sick person. In light of the generated findings, the following are hereby recommended. First, a more comprehensive health education and promotion on HIV and AIDS program should be developed for the general population. This should aim at providing accurate information that gears towards eliminating stigma and discrimination among people living with HIV so they can disclose themselves and seek treatment without fearing negative judgment and treatment from other people. Second, teachers and other professionals are encouraged to undergo HIV testing, especially if they engage themselves in risky sexual behaviors. And lastly, the findings of this study can be validated by conducting the same, which involves people from other professions. Here are the references that I use in my work.
And I would like to end my presentation by sharing with you this quote stated by Kael, a person living with HIV, when he was featured in a noontime show. He said,
Guys, HIV is not a disability. Yes, it can kill our immunity, but never our humanity. Maraming maraming.
my friends, people living with HIV are still people. Hence, they deserve to be treated well and taken care of, just like any of us people. Again, I thank you all for listening and keep safe. Mabuhay po tayong lahat.